Back. I'm Dr. Elizabeth McMahon. I'm going to start screen sharing so that you can see the slide deck. And there we go. So welcome back to Module 3. Here are the introductory slides that you've been seeing that you're familiar with. So what we're going to focus on today is dealing with predictable, challenging, difficult reactions on the part of people who are stressed, either in a disaster or they're traumatized or they're stressed for whatever reason. And I know that in the pre-course questionnaire, the big reaction was, how do you deal with people who are angry? So I promise you we're going to talk about that today. In fact, if you think about the 4 modules in this course, maybe module 1 was, I don't know, like the appetizer, and module 2 was the side dish. Today is the meat. And then module 3 next week's going to be the dessert. So you definitely want to sign in for that one. Just reminding you again, this is the original curriculum was created for neighborhood emergency response teams, the San Francisco version of the CERT, Community Emergency Response Teams. It was funded by the Department of Public Health and co-written with me, along with me, Susan Schmitz, who has a master's degree in international disaster psychology, who at the time was working with San Francisco CARD, San Francisco community agencies responding to disaster. And then we got feedback from Captain Erica Arteseros of San Francisco Fire Department, Terry Dowling of San Francisco DPH, assistance with Shea Valdez, and then feedback from NERD members. So originally written for lay volunteers to be interacting with survivors of disaster. It's been expanded and adapted to cover skills dealing with basically anyone in any kind of a stressful, traumatic, or disaster situation. I would encourage you to watch all 4 modules, just a really quick review. First one dealt with common effects of stress, coping with stress skills. You got to work on your own stress signals and come up with your own stress management skills. And there was information about PTSD. Here were the skills, the 5 skills that were covered. And you'll use these just over and over and over again. These are the basic background skills. And then last week we talked about how to make a fast connection with someone, how to connect quickly and effectively using your body, just non-verbally, your tone, your pacing, your words, how to get their name, the I help you mnemonic for introducing yourself and connecting, and some of the, sort of the magic words that help increase cooperation, like because and yes and finally ended up with self-talk that supports your coping. There was a question raised last week and I got the answer for you. So the question was, how can I tactfully ask about gender in a way that is inoffensive? I don't want to offend anybody. And so I got in touch with Dr. Sean Giametti, who's an expert in this area. And his recommendation was simply to ask, what are your pronouns? Or what are your pronouns? I use she, her, or I use he, him, or I use they, them. Okay. If you have any questions or comments, of course, at any time, use the chat button. What we're going to do today is focus on covering on the 5 common challenging reactions. And after we've covered skills for all 5 of them, you're going to use the worksheet, and the worksheet for this session is the mentally prepare worksheet. I want you to have that out and be ready to use it toward the end of today's module, because this is where everything comes together and you start to look ahead about what the problems would be. You do what we call a pre-mortem, which I talked about last time. You think ahead. And what I ideally like, if we have time, is to have you then share, so that after we've done all this and we're ready to, everybody's ready to sort of share, here would be a challenging reaction for me, and this is what I would do, or a challenging situation, and here's my plan. If you put in the chat your name and that you'd like to share, then either Brian or Chris, who are co-hosting, can go and unmute you, and we can actually have a little bit more dialogue and interaction. So, all right, so 5 common ways that people react in a disaster, stressful, traumatizing situation. They get just temporarily overwhelmed and shut down. They're crying, they're grieving, they get overly worried, they have panic attacks, they get angry, you know. So first things first, the very first thing you have to do, the most important part of psychological first aid is safety. Safety comes before everything else. People need to be physically safe, and they need to know that their needs are going to be met. That is the most reassuring, the most calming, the most important part of any interaction, any involvement with psychological first aid. So start with that always. And, you know, you can be very reassuring about the intense emotional reactions that happen in disaster and trauma, because the research is pretty encouraging that for most people, the majority of these reactions do subside. We are resilient people. We do process what happens. Now, if you've been repeatedly traumatized, if you've had adverse childhood experiences that make you more vulnerable, if you are dealing with trauma day after day after day after day, you know, that's less likely to be the case, and you may need to more actively process traumatic feelings and reactions. But overall, people get better. We hear a lot about PTSD, but that's not the majority of people months out after a trauma or a disaster. So although you can't guarantee, and you don't want to make a promise, and you don't want to be terribly specific, you can say, you know, this is a very natural reaction. It's likely to subside with time. You know, most people find that they feel much better within a matter of weeks. You know, so words like most people, better, likely, so that their own expectation is that they will get better. And of course, we know that's more the case if you can keep them together with their support network, and if you're using all the skills that send calm to them and that reassure them so that they pick up on your calm. All of that contributes to this. Another way to help reassure and make people feel safe is to see if they can have comfort items. So, you know, I think part of the robes that you get, what am I thinking of, blankets that you get, are not even so much to keep you warm, but they've got this second meaning of I'm being comforted, particularly with children and with anyone who is perhaps having some cognitive difficulty, anyone who's demented, just something soft that they can hold. A stuffed toy for animals, or even for an elderly demented person, the soft blanket, if there's a personal effect that they have that they can cling to. Religious items may be reassuring. Now, all of these tools I'm talking about, you know, they're to give you tools to give you better chances of calming people down. Nothing's magic. Nothing's going to work with everybody. And when you have people who are severely distressed because of mental health issues, because of ongoing substance abuse issues, know where the mental health professionals are. That's the time to refer. But for the people who are just having the normal response to stress and disaster, right? You can use these skills and they can be incredibly effective. Now, again, remember, there's emotional contagion. You will pick up on their emotions. They're going to be angry, anxious, sad, grieving, right? So notice your mood, monitor your mood, and use the skills you've learned in the earlier modules to change your mood and to send your calm out to the people that you're working with, because emotional contagion goes both ways. They catch your mood as well as you're catching theirs. So the more you can consciously manage your emotions, the better. And the more stress skills you have, the better. And this is, again, where you use those fast connection skills from module 2 to come across as calm, caring, and competent. So your general guidelines in what you say to people, you want your words, they've got to be true, you can't lie, but you want them to be helpful. You want to be realistic and supportive. So phrase everything that you say in the most encouraging way, in a way that emphasizes hope, resilience, courage, calm. Stick to the facts. Don't promise what you don't have any control over, but always be emphasizing what can be done, what's going to be done, what's being done, what they can do. So there might be examples such as saying things like, the worst is over, or help is on the way. Acknowledge the bad. You're in pain, your leg's been injured. We will make sure that you get medical care. Now, that's not saying right away, right? But it reassures them that something's going to be coming. You always want to focus on the positive and on the hopeful. If you don't know, you might say, I don't know, but I'll let you know as soon as I do, right? It might be things like, I promise we'll get to everybody, or even just, we know you're here. So if there are phrases like this that you find yourself using a lot, you might share them. Feel free to share them with everybody in the chat, because we can all benefit from learning phrases. Words program our mind and our body. They program our body and our emotions. So the words you use make a huge difference. If you're saying, wow, that looks like a bad injury, we're not going to move you, that's very different from, we see that you've been hurt, we're going to take very good care of you and be very gentle. Right now, we want you to stay here so that we can bring the best care to you. Something like that. So if you feel like sharing in the chat, please go ahead. I want us to learn from one another and to benefit. And I can monitor the chat. And meanwhile, let's move ahead to those difficult, challenging reactions. Now, remember all the tools that you've learned earlier. If you get triggered by any of this, what are you going to use, right? Use the 4 for calm breathing, low, deep in the belly and the diaphragm, counting slowly 4 in, and then even more slowly 1 to 4 as you breathe out, to calm sympathetic nervous system arousal and to activate the parasympathetic branch of the nervous system, right? So here are the 5 reactions we're going to be focused on today. We'll start with those who are temporarily overwhelmed. when someone, you know, I remember going to the hospital to see a beloved neighbor post-surgery and being told that he had died. And there was just, I mean, I literally took a step back. It was like too much to deal with for a moment, right? In a disaster situation or traumatic situation, people may be so caught up trying to just come to terms with what has happened that they're not very connected with the outside world. They're not connecting with other people. They're not responding to you. Now, we're not talking about a concussion. We're not talking about a psychotic break, right? We're talking about this temporary being overwhelmed and becoming passive. So because they're overwhelmed by the intensity of their response, you want to do everything you can to calm and lower their level of emotional arousal. So use calm, exude calm, use your fast connection skills, right? So get their name. That's the I help you is the mnemonic. Hi, I'm Elizabeth. I'm here to help, or I'm with the fire department or whatever, but I'm here to help you is the message. What's your name? You want to get their name. Our name is one of the earliest things that we're taught to say. You know, right? You think about, you're dealing with a little kid, right? What do you ask? Hi, what's your name? Yeah, and then how old are you, right? So it's one of the earliest things we learned. It's one of the most overlearned responses is to say our name, and it orients our attention. We respond to our name. If you've ever been in a loud room and there's just sort of general noise and chatter, and all of a sudden you hear your name, right? It just gets your attention. So you want to exude calm to help lower their arousal. You want to get their name to get their attention. And you want to get them to focus on you so that they're focusing outside of their head. And you want eye contact, unless it's clearly uncomfortable for them, right? You're going to be using short phrases. Remember, people generally who are stressed don't cognitively process a whole lot. So in general, you want to give short, simple phrases. With someone who's temporarily overwhelmed, that's even more so. Look at me, Gary. That's right, Gary, look at me, good. And you want to reinforce any connection and any following of your instructions immediately. So you want to be very, very reassuring and praising, right? You want to be very supportive. So let's say you go up to someone and you can see they're just staring off into space. You get down to their level, you make eye contact. Hi, you say your name. I'm here to help. What's your name? Hopefully they've responded enough to take your hand so that now you've got a physical connection, assuming COVID, right? Things are safe. Ideally, they give you their name. You start to use their name repeatedly. You have them make eye contact with you as soon as they say their name. Thank you, Gary, Joe, Sue, we need to get you to safety, or what is it that you need, or do you need water, or tell me what you need, or whatever you're trying to do, or even just if you're just trying to connect them and get them less aroused. I know this has been a lot. You've been going through a hard time, right? But if you're trying to get them to safety, the minute they do anything, that's right, that's good, and be very supportive. That's right, you can do this. That's right. Let's get you out of this house. It's not safe anymore. Okay, let's get you over to the Red Cross. Let's get you over to, right? And you're safe now can be one of the most powerful things to say. You're going to see the need, say the need, say what they need. What are you trying to do for them? What do they need from you? and get their agreement, and be willing and ready to repeat instructions and information as often as needed, right? So let's say somebody's gazing into space and not responding. You get their name, and you say, okay, Gary, look at me, good. Okay, I'm Elizabeth, right? Say my name. You remember who I am, right, Elizabeth? Good. Okay. Now, yeah, and if they just kind of glance at you and then look away or look down, just because they're overwhelmed, not because they are uncomfortable. If they're looking deliberately sort of off to your shoulder, and you get the sense that they're on the autism spectrum, then look over their shoulder as well, but continue all the other skills as usual. Okay. Short, simple phrases with yes and with because. So yes, I know you're overwhelmed. It's really hard. It's a lot. And right now we need you to get to safety, go over to the Red Cross, fill out this form so you can get housed, because, right? So yes, which acknowledges how hard it is, and transitions to what they have to do, even though it's hard, even though they're overwhelmed right now. And because, why? People who are overwhelmed, get them moving. Just physical activity will use up some of the adrenaline, and they'll have to pay more attention to literally where they're putting their feet and where they are. And once they're more engaged, if you can give them something to do to, again, keep them connected with the outside world in some way. I think this is the classic. I think this is part of what goes on with the classic British, can I get you a cuppa? You have the cup of tea and you're holding it and you're sipping it. It gives you something else to focus on. If it's a disaster situation, and you have to deal with many, many people, see if you can pair someone who is sort of passive and overwhelmed with someone else who might be there to listen, to comfort, to again, just be someone that they can focus on, right? Remember that one of the responses to stress is it's hard to concentrate, it's hard to think, it's hard to remember. So they're going to have trouble responding to you. They're going to have trouble focusing on what you're telling them and understanding instructions and recalling them, right? Okay. If you have more time, there are more direct skills that you can use to focus and ground someone. So I'll just go over some of those right now, right? One is have them focus on you, right? Look at me. What's my name? Say my name. That's right. Good. Can you hold my hand? Good. Can you stand up? Good. Right. Feel right. You can have them focus on uninjured body parts. This may be particularly helpful for people who are have one part of the body that's injured and are in pain, and you can't immediately relieve the pain, and they're not going to immediately get medical care. You can ask them to both slow their breathing down, long, slow exhales, right? Because to sort of calm the body. And you can ask them to focus very, very intensely on the non-injured parts of the body. I see your left leg has been injured. How is your right leg? What about your right foot? Your right arm? How's your left arm? How's your face? I want you to really focus on those parts of your body. We know the left leg is injured. It doesn't need to keep telling us. I want you to really focus on everything that you're feeling in the other parts of your body. This is basically sort of a hypnotic distraction technique, because we tend to focus on what hurts, but the more we focus on it, the more it hurts, right? If they're in safe surroundings, have them, again, look outward. So you may remember the mini mindfulness technique that you learned in module 1 as a way to get out of your head and reconnect. and calm and feel more grounded. And then, of course, there's always the 4 for calm breathing, right? If you teach them that, you show them, you monitor. If they can move both hands, have them put a hand on the chest and a hand with a finger on the belly button, and see that the breath in moves the lower hand and not the upper, and that the lower hand moves in as they breathe out. So here's just a quick summary of some of the skills. And then here's the mindfulness, if you've got time and it's safe, right? And you can do this with a group of people. You just don't have them say it out loud or it's chaos. You have them say silently, but 5 things that they see, 5 things that they hear, 5 things that they feel, right? Centers, calms, decreases the chatter in head, connects them with the environment. Or there's a real snapshot. Tell me what's happening right now. Describe what's happening right now. And this can also be useful for people who are like, my God, I don't know where my family is, and the house is burned, and all the papers are gone, and where am I going to eat? And I don't know where I'm going to have to sleep. And what, there's so much. You say, okay, stop. Let's just take a snapshot of where you are right now. Do you need to eat right now? Right? Do you have a safe place for tonight? It helps take this overwhelming situation and break it down into manageable bits. I learned this from someone who their job is working with the homeless in crisis. It's like, let's just take a snapshot right now. So there's some tools for people who are overwhelmed and passive, not connecting. You've got the people who are going to be crying and grieving. And, there are so many ways to express grief. It can range from wailing to moaning to sobbing loudly to crying quietly to being absolutely stone-faced and just shutting down to being angry, because anger feels better than the pain of grief. And when we grieve something we can't change, which makes us feel helpless. And we hate to feel helpless. People hate feeling helpless. So one of the real things to remember about grieving is that there's no one way, there's no one right way. Everybody has a different way of showing it. That crying is not a psychiatric emergency. Crying is self-regulating. We may cry a lot and up and down, but crying sort of has this release, and there's even some release of stress hormones through the tears. So allowing someone to cry, assuming that doesn't put them in immediate danger, right? If possible, providing some privacy. If possible, and you've got the time, sitting with them, listening, empathizing, offering a welcomed touch, because again, right, that's like, they're not alone, I'm here with you. Again, assuming that is safe and welcomed. People don't expect you to make their loss better. They just want to know that their loss is acknowledged and that their emotions are heard and accepted. One of the most important things you can do is to just say, I'm so sorry. I'm so sorry you're going through this. That's so hard. That's so painful. Acknowledge the importance. That person was special, or that place was special, or that thing, or that pet, whatever it was. My heart goes out to you. You're offering compassion and acceptance. And you may feel like that's not doing much. But let me tell you, it is the most important and one of the rarest things, because it's really easy. Remember, we talked about emotional contagion and empathy. If you start feeling the pain of somebody else, you don't want to feel that pain. And we can fall into the trap of saying things that essentially are shut up. Stop feeling pain because I'm feeling your pain. Not helpful. I've talked about words that are magic words, phrases you want to use. Here are some words you never want to use, never, with grieving. One is at least. At least you're okay, at least, you only lost one member of your family, not all of them. At least it was a dog and not a person. Nothing good is gonna come after at least. The other is you should. It's telling them what they should do. That's just the opposite of compassionate acceptance. You should appreciate what you still have. You should be glad they went quickly. You should be glad they're in a better place. You should let it out and cry, or you should have a stiff upper lip, or right. The other phrase I would say to avoid is, I know how you feel. Because first of all, you're not them. And that's not what they need to hear. They just need to hear that you can tolerate their pain. Now, if you need someone who's crying and actively grieving to do something, that's when you do a yes and a because. Yes, you have every right to grieve. This is really painful. You've lost a lot. And right now we need you to fill out this paperwork, answer these questions, move to this safe place, because we need to get you shelter, or we need to get you care, or we need to get you to safety, right? All right, questions, comments, reactions. We've covered what to do when someone's sort of passive, how to connect really strongly, and then sort of pull them away from what's overwhelming them in their head and get them connected to you, to activity, to another person, to the environment. We've talked about dealing with someone in the throes of grief and someone who's crying. Now we're going to talk about people who are overworried. How many of you know people who worry all the time about everything, who are worriers, who over worry, right? Anybody know that? I'm gonna imagine that I can see all those hands going up, because we all know people like this, and they're not going to go away in a disaster. They're still going to be with us. So here are some tips. Interestingly enough, people who over worry, who are always the sort of like the what if this, what if that, what if this, what if that, right? They actually do better if you tell them the bad news as well as the good news, which seems very paradoxical. But the reason that is that if you only tell them the good news, if you think, oh my God, they're going to worry, I don't want to tell them that. Let me put a spin on it. Let me just change what I tell them. Let me only tell them this little bit. They're already assuming that things are bad. They're worrying. And if none of that is acknowledged, they may think it's so bad they can't even tell me what's wrong. And then they'll fill in the blank. So you're actually better off telling them the bad news and the good news, what you don't know and what you do know. So think ahead about the natural worries that people will have in any kind of disaster, right? So where am I going to sleep? Where am I going to live? How am I going to get food? How am I going to replace my papers? How am I going to get clothes? How will I get medical care? Who's going to look out for me? How will I connect with my family? How do I know where my family is? How do I find out about missing loved ones? When can I expect help? Think ahead. about the questions that you're routinely asked or that would be asked in a disaster or stress situation, right? And try and get your answers ahead of time. So you go into this, any disaster or stress situation with as much knowledge as possible and with as many answers to the common questions as possible, right? Again, like I said, admit what's not known. You come across as honest and therefore trustworthy and reliable. And what calms people down when they're worried is like, okay, I've got somebody who knows and who I can trust to tell me what they know and what they don't know. I can trust this person to give me the honest scoop. So if you feel like you're getting the whole picture, then you won't, in your own mind, be filling in the blanks with your worst nightmare scenarios, which is what worriers do. Avoid saying everything will be okay. Because unless you're God Almighty and you control everything, I don't think you can say that. So what you can say again, however, is, what's reassuring. Well, what if there's a tsunami after the earthquake? There's no indication. There's a warning system. We've got you on a high hill, so it's not, tsunami would likely be stopped as it went over the lower ground, whatever would be practical. What about if the fire restarts? What if? Think about the what ifs. Think about what you can say. Now, after you tell them what's known, what's not known, the bad and the good news, after you've reassured the unrealistic worries and given them factual answers for the common questions, then for heaven's sake, try and find them something for them to do. Because worriers have all that energy and you want to use it. Maybe have them hand out papers or hand out water or hand out food or, play with some of the groups of the kids and lead them in songs and games and jumping jacks. Anything that gets them active and involved gets the focus again out of their worry head and onto the actual present environment, what's happening now, and gives them something to do to direct that energy. Okay, good. So let's talk about people who are panicking. Panic attacks. Yeah. So if we were meeting in person, I would ask you to raise your hand if you'd ever had a panic attack or known somebody who had a panic attack. And if you want to put in the chat, just yes, go ahead and do that, right? Yep, I'm seeing hands go up, right? Yeah. There was one study where they just did a phone survey of the general population, right? And described the signs of a panic attack and asked, had you had this in the previous year? You know what percentage of people had had a panic attack in the previous year? Wasn't 10%, wasn't even 20%. It was 31%. Yeah, absolutely. And catch you off guard, holy cow. Yeah. If we know what's going to panic us, that's usually phobia, but panic attacks usually come out of the blue and all of a sudden your heart's pounding or you feel like you can't breathe or like there's a lump in the throat or you get dizzy, you think you're going to pass out or you get visual changes or you're sweating and you're hot or you're cold or you're tingly, you get numbness, right? Scarier and spit. So you can be guaranteed that some large percentage of the people you work with have had a panic attack and may be vulnerable to having a panic attack. So let's talk about what you can do. Okay? So, what is a panic attack? Right? Yeah. Feeling you no control makes it worse. You feel out of control, which panics you, because the panic attack is the natural, automatic fight or flight response to danger, but going off in the absence of actual danger. So if my heart's pounding and my muscles are all tense because I'm running away from somebody coming after me with a knife, if I'm running from a fire, if I'm running out of a building that's going down in an earthquake, right? If I'm jumping out of the way of a car that just, ran a red light and almost ran me down, I'm, right? But I don't say, oh my God, I'm going crazy. I say, oh my God, did you see it? He almost ran me down, right? But when it comes out of the blue with no obvious reason, that's really scary, because we're thinking, wait, I don't understand. This isn't making sense. What's happening? It's not under conscious control. It is an automatic, hardwired, built-in response to perceived threat or danger. But the part of the brain that perceives the threat is not a very smart part of the brain. So it can go off in response to actual danger. It can go off in response to memory of actual danger. It can go off in response to worrying about something in the future. It can go off in response to just changes in your body if you've become frightened of those, or something in the environment just suddenly reminded you of a stress. And it's not triggered up here in the conscious part of the brain, right? It's back here in the amygdala. Goes off without your awareness of why. Now, that's the bad news. What's the good news? Well, the good news is that our bodies are designed to have this response. I mean, the entire purpose of the response is for it to be life-saving, to help us run to safety or fight our way and survive the fight. Sometimes you hear it called a fight, flight, or freeze response. And the freeze response seems to be when you don't know what to do yet. And so your body's ready to run or fight, but you don't know which one you ought to do, or if you ought to just, like hide and see if the danger passes. Right. There we go. Right. The freeze response. Right. And so that's more likely to happen in a really traumatic situation, let's say physical abuse or molest, where you're helpless. Somebody, pulls a gun on you, and you haven't been trained in disarming somebody, but the body is still prepared to run or fight. So you're never paralyzed. You can always move, but it's like you don't know what to do quite yet, right? Now, this is very similar to the stress response, which is why I'm going to be emphasizing throughout this entire class, preparing ahead of time, thinking through ahead of time. What would I face that would be frightening, challenging? What would I face that might make me feel helpless and like I don't know what to do? How could I respond to it? What will I do? Practicing physically and mentally, so that when something happens and you get the physiological arousal, you can direct it into appropriate adaptive action rather than running, fighting, or feeling frozen and not knowing what to do. Okay. So good news, life-saving, our body's built to have it. If you're basically healthy, not going to harm you. Very similar actually to what happens when you're exercising hard. Bad news, it can misfire. And when it misfires, if you don't know what's going on, it's very frightening, because the whole response has a physical and emotional and cognitive, has 3 components to it. So each part of it is intended to have a life-saving purpose, right? So physically, the muscles tense to get you ready to run or fight. And among the muscles that are tensed are the belly muscles, right? Our soft underbelly. Well, take a second right now and tense up all your muscles, and particularly tense up your soft underbelly. And now try and breathe, right? Which is one of the reasons why that 4 for calm diaphragmatic breathing is so important to practice and use. The muscle tension, watch, I'm shaking my hand, I'm waving, right? Here, I'm trying to hold my hand steady, and I'm going to tense my muscles. And if I panic that I'm shaking and I try and tense harder to make it stop shaking, it shakes more, which is sort of a paradigm for panic. The more you fight it out of fear, the worse it gets, right? If I'm tense and I relax the muscles, the hand gets quieter. So muscle tension can cause shortness of breath. It can cause shakiness. You know, the brain thinks that we're going to need a lot of oxygen, that we're going to be using a lot of oxygen to run and fight. So it starts you breathing more shallowly and more quickly. What that does, unfortunately, when you're not using up a lot of oxygen running and fighting, is that it throws the oxygen carbon dioxide level in the blood off and changes the acid alkalinity level of the blood and the CO2 level. So as a result, you can feel like you're short of breath and like you're not getting enough air, when the reality is you're breathing too much and too fast. There are also changes in blood flow. So the blood vessels, particularly in the extremities, get automatically clamped down to redirect the blood carrying oxygen and glucose fuel to the main trunk muscles to run and fight. So with the redirection of the blood flow, you may feel hot or you may feel cold. Pulling the blood away from the extremities can cause tingling and numbness, right? And since if you think about the body, what are our extremities? Feet, hands, head. So there's a perceptible, harmless, but perceptible decrease in blood flow to the brain, which can contribute to feeling dizzy and unsteady. Plus, the pupils automatically dilate to expand the field of vision so that you're less likely to be ambushed. But that can create, again, contribute to a sense of dizziness, blurriness, a sense of unreality, a sense of not being present, not being there. Okay, so now you've got somebody who's stressed, maybe in a disastrous situation. All of a sudden, now they're feeling like they can't breathe, they're shaking, their heart's pounding, they feel tight, they feel like they're not getting enough air, they feel like maybe they're not there, and they're going to think, oh my God, I'm going crazy, I'm having a heart attack, I'm passing out, I'm having a stroke, right? So they panic about that. The amygdala picks up in the panic, pumps out more adrenaline because, oh, if we're panicked, we must be in danger. Here, have more adrenaline to help you fight. And the whole thing goes south really fast. So, right? The whole digestive system gets shut down because, you don't want to spend any energy eating and digesting if you have to run and fight for your life. So you can get nausea, diarrhea, queasiness, even vomiting, all those famous performers who throw up before they go on stage and give award-winning performances, So that's the physical. The emotional is panic, right? And the cognitive changes, the mental changes in terms of thinking are essentially there's this message of danger. And so the mind gets flooded with thoughts and danger, and they start looking around to see where the danger is. So they either decide that something in the outside is dangerous, or if they can't see an actual danger in the outside, they will turn their attention inside. What's going on in my body? Maybe it's a heart attack. Maybe what's happening in my body is dangerous. So people with panic can think. Sometimes people say, I can't concentrate, I can't think when I get panicked. Well, you're thinking just fine. The trouble is you're thinking about danger. You're thinking about what frightens you. You're thinking about your fears. So A lot of the physical symptoms are created by the breathing too fast and the muscle tension, and of course by adrenaline that's being released. The good news about adrenaline is the minute it's released in the body, it also begins to be immediately automatically broken down and used up. Now, if someone could start running in place, they might use the adrenaline up faster. That's probably not going to be very practical in this situations where you're dealing with people who are panic. Panic attacks on their own tend to stop automatically in 5 to 20 minutes, and sometimes sooner, sometimes 3 to 5. But if you can relax the muscles and slow the breathing, it really speeds up. So what you want to do is stay extremely calm, because you don't need two people panicking. You want to tell them what is happening. Looks like you're having a panic attack. You're having an adrenaline reaction. It's intense, it's uncomfortable, it's scary, it's temporary, it's a completely normal response to stress. I can help. Are you willing to let me help you? Right? And then have them focus on you. Teach them the 4 for calm breathing. Have them put a hand on the belly, hand on the chest, and shift their breathing down there. There's a special breathing, Now, if they can't do that, you could also try having them just grab their breath and then have them hold it while you maybe count to a count of 4, and then have them blow out through pursed lips, which slows the breathing. If you can stop the over rapid breathing, the hyperventilation, that will really calm down a lot of the physical symptoms. As the physical symptoms calm down, they'll feel less frightened. Okay? Comments, questions, anything you want to put in the chat about that? Okay. All right, so on to everybody's favorite, people who are angry. So let's talk a little bit about anger. In psychology, anger is described as what's called a secondary emotion. What this means is we get angry in response to things, okay? So the classic example is you're driving down the freeway and all of a sudden, out of nowhere, somebody is suddenly in front of you, and you slam on the brakes. They then cross 2 more lanes to get off on the exit that was only, 2 yards in advance. And there you are, right? Shaking and heart pounding. But right before you got angry, what were you feeling? Terrified. My God, they're going to hit me. My God, I'm going to hit them, right? So anger is a response to some form of pain or threat, right? And again, this can be, we all experience pain from different things. Some things don't bother us that bother other people. And we respond to perceived threat. And what I see as a threat is going to vary on my personality, my past history, my other experiences, the current situation, right? So it's not that they necessarily have a right to be angry, but in their minds, there is a reason for their anger. There's injustice or unfairness. I've been treated with disrespect, or there's grief or loss or fear. Anything that causes pain or threat will trigger anger. So when you hear anger, you want to listen to what's the real issue. Okay? The other thing is, and I know this is not easy, but don't take it personally. They're angry at the situation. They're angry at the pain they're going through. They're angry at what's happened. They're angry at being helpless. They're probably not angry at you. You just happen to be there and be safe. So when you're physically interacting with someone who is angry, you add a fourth. In addition to being calm, caring, and competent, you also want to come across, you want to be safe. So let's talk about what safe means physically, okay? So if I come up to somebody really close, that's not safe. If I'm straight on with them, that's not safe, that's confrontive, right? If I'm like this, or like this, or like this, even now, calm down, that's too close, and it is perceived as intrusive or threatening. So what you want to do, if at all possible, is approach at an arm or leg length away, at an angle, and with your hands open at your sides. So instead of this or this, it's this with the hands, literally showing I'm open to listen and I'm not a threat. And instead of this or this, it's this at an angle. I'm open, I'm not a threat, I'm not confronting you. You're an arm or a leg length away, so they can't kick or hit you. And if they come at you, you can pivot and run because you're at an angle, right? You want to use all your stress skills, all your fast connection coping skills, and you want to think of your hips as headlights, okay? Okay, interesting. Yeah, don't get them in the headlights. Just give them a little, right? You want to use a quiet, gentle voice. You want to talk quietly. You want to do the I help you. You want to be a person to them, not just a threatening authority. Hi, I'm Sarah. Hi, I'm Joe. Extend, maybe extend your hand, or maybe just, keep the hands open if they're really angry. What's your name? I'd like to help. The more quiet you are, the less likely they are to yell. The more you yell, the more you raise, the more they'll raise to go over you. But if you get quieter and quieter, they'll tend to come down too. You can also say, right? See the need, say the need. You're angry, you're upset, you want something, you're scared, you're whatever, and trying to say, you're in pain, you feel disrespected. If you can talk about what's under the anger, right? The real issue, and say it's understandable because they believe that it makes sense. So you can certainly say it's understandable. You may not agree, but you can acknowledge this is a very difficult, painful, confusing, frustrating, situation. And then you say very quietly, can you please speak more slowly? I want to understand. That's a wonderful phrase. Can you please speak more slowly? Because if you've ever tried to yell slowly, it's really hard. And people tend to match their pitch and their volume to yours. You're not going to say, now calm down. You can speak firmly, but not forcefully, not trying to force anything on them. If somebody is escalating, see if you can move them away from other people if there are other people around. Now, don't go someplace where you're not going to be safe, but you want to avoid emotional contagion, the whole crowd getting riled up, and now you've got lots of angry people. And you also want to avoid, you want to bring them to a situation where they don't lose face if they calm down, right? You want to show empathy and interest. You want to see their perspective. They just want to be heard. Yes, yes. And man, that is so uncommon in many ways. But if you really think when somebody's angry, you don't have to defend yourself. You don't have to get them to not be angry. You want to listen to what's really going on and hear that and show them that you hear that. And then offer what you can do. I want to help. Now, if they want something that you just can't do, acknowledge that, but please do not go into a long explanation about why you can't do it. I mean, have you ever been on the phone with somebody, some service, and well, we can't do this because I don't want the explanation. Just say, I can't do that. I could do this. So I often think of it as as the toddler technique. If you're trying to take something away from a 2-year-old, you just kind of take it, they're going to grab on. But if you say, ooh, look what I have, I can give you this, right? So when you can't do what they want, quickly pivot to what you can do. Well, I want my daughter seen right now by the doctor. You can see that the daughter's in pain, but not top triage. And you can say, you want your daughter seen, you want to make sure she gets treatment. I will make sure that the doctor knows she's here. And can I bring you some water? Can I bring you some food? I think we might have a toy. What might help? Okay. So you just focus on not their emotion, but what you can do. And if possible, give them a choice. I can't this, but I can this or that. Which would you prefer? Which would help? Because when you're given a choice, first of all, they have to stop focusing on the mad and they have to think about the choices. Second of all, you're showing respect and you're showing that you want to help. It's really easy to get flustered or defensive when someone's angry. So very consciously use all your skills and all your tools and really focus on, can I do something for you right now? Now, sometimes you're just not the right person. And sometimes you have to say, I can see that I'm not, would you like me to see if I can find somebody else who might be able to help you? Sometimes people respond better to one person than another, right? They may just need time, right? You can't help everybody, but these tools will really help. Now, we've gone over these, and I just want to mention, my background is in psychology, as a clinical psychologist, and I've run crisis groups, and I've done emergency on call to the hospital at nights and weekends, to the emergency room, as well as dealing with people who have panic attacks and anger issues and everything. Just to see, I want you to notice how similar these skills are to the de-escalation skills that are taught, that were, created for and by police officers and firefighters. So here's a summary of de-escalation skills from the SAMHSA website, Substance Abuse Mental Health Services Administration, from their online course for police officers and professional first responders. And if you want to check it out, it's an interesting, it's an interesting video. But I want you to notice all the similarities. Okay, they say make yourself as calm as possible. Right, for calm breathing, relaxing the muscles, using your stress management skills, knowing your stress signals. Present an appearance of calm with an assured and calm demeanor and a neutral expression. So that's the gentle smile. That's the physical, approach to someone. Make eye contact. Have a relaxed, alert posture with your weight evenly balanced, right? This is the slightly tilted, hands open. Yes, 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 yes. And yes, you get a lot of angry people. Yeah, and a lot of times you can't fix the problem, which is really frustrating for everybody. It can help. Just empathizing can make such a difference. Yeah, I think there are two parts. People like the problem solved, of course, but they also want to be heard and acknowledged and feel respected. And even if you can't do the one, you can always do the other. right? And yes, don't put yourself in a position where you make promises you can't keep. This goes back to be helpful and supportive, but be true and realistic. Don't promise, only promise what you can say. Think about your phrasing so it is as optimistic, as hope inducing, as resilient supporting as possible without crossing that line of saying something you don't have control over. If you don't physically control it, you can't promise it, right? I will, great. Thank you for putting the chat for putting the link in the chat, right? So what else do they go on to say, right? Give them space, have an exit and an escape plan, right? Angle so you can pivot and get out. Keep your body movements to a minimum, right? Slow and deliberate, right? That's how you come across as calm and competent. Establish a connection, right? I help you, get a yes, see the need, say the need, to show them that you're in a protective, helpful, understanding role. I hear you. I empathize with your pain. I understand how you see things. Tell them what you're going to do before you do it. That's the get a yes, get permission. Are you willing to, right? And be prepared to repeat, because we know, right? Can't take stuff in, particularly when emotions are high and they're focusing on being heard. It's like you've got a teacup that's full and overflowing. You can't pour anything more into that. You got to let it dump out before you can put something in. And in the de-escalation course, they also talk about things not to do. Don't raise your voice. Don't tell them to calm down. Don't argue. Don't judge. Don't get defensive. Don't get too fast. Don't ask too many questions, right? All consistent with what you've been learning, right? The final piece of today is the process of mentally preparing. I cannot overemphasize to you how important this is. If there was only one thing I could teach, it would be this. So I want you to get your mental preparation worksheets out and use them. This skill is used by Olympic athletes, it's used by special forces, it's used by elite military first responders, performers. You mentally imagine, you visualize, you walk through, and I say visualize in a general way, because some people vividly imagine visually, but other ways it's like you just feel it, or you hear, or you think it through. All of that is effective mental preparation. It increases your effectiveness because you've thought about what you're going to do. It decreases your primitive brain's response and moves it up more to the conscious level. It increases your confidence because you know what you're going to do and you've prepared. And that reduces your arousal, which increases your resilience. So this is just, good for everything. The way this works is you vividly and very specifically imagine and plan. And you think about the stuff you don't want to think about. You think about what could go wrong, what would be really awful, what would be really hard, what would be challenging for me, what do I don't quite feel prepared for, what do I hope doesn't come up because I don't feel prepared. You want to take this time before it happens and delve into that so that you have your plan and you are prepared. The more specific you get, the more you rehearse it, the more vivid you make it, the more it is overlearned and just into the mind and the muscles, the more automatic your responses come, right? Remember how we talked about the primitive brain that reacts, the amygdala, right? It can't tell the difference between information it gets from the outside, that's through the retina to the visual cortex and sent down to it, versus information that's created inside the brain and sent down to it. So therefore, what you imagine to the part of the brain that reacts and triggers anxiety and stress and panic, what you imagine has almost the same impact as what actually happens. That's why we respond to movies, right? It's why we respond to nightmares. It's why we respond to just our thoughts. You're going to use this to prepare for crises. And we're back to doing a pre-mortem, which I talked about last time, right? Looking ahead, what might go wrong so that you can avoid it or cope with it. So this is how the process works. You write down what could go wrong, what would be hard, what would be difficult, what do I feel I'm not ready to deal with, what would upset me. And then you write, and this is how I might respond. This is what I might do. This is how I would cope in order to either avoid it or minimize. Exactly how you train for endurance races. Visualize every aspect and every potential hazard. Yes, yes. It's how skilled people train for everything. And then you repeatedly walk through the plan until it feels really comfortable and really familiar. Okay. Now, I'm going to give you some examples. These examples were designed, right, to talk about difficult, challenging, upsetting situations. So I want you to take a moment right now and just do at least one or two low, slow, 4 for calm, diaphragmatic breaths with a slow exhale. If these trigger distress, stop, look away. Put your hands in your ears and do da 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 till I'm done. All right. So here's the first one. There aren't enough staff and resources. Yeah, we've never run into that before. You have multiple tasks and you don't have enough time, and people are demanding and they're yelling, and you're finding it increasingly hard to concentrate and hard to prioritize, and you feel overwhelmed and you don't know what to do. Right? Anybody imagine being in this situation? Yeah. So think about that situation, how you're going to feel. And now think, what could you tell yourself? What could you physically do? And if appropriate, what could you say to other people? So here are some examples. They may be what you do. They may be similar to what you do. They're just to get you thinking. So you might just say, okay, one thing at a time. I can only do what I can do. What's in front of me? Shift my breathing, maybe roll my neck to relieve some tension. And maybe I ask, well, what needs to be done? Ask for direction or prioritize, ask for help. Maybe I say, time to take 5. Here's a second situation. The person you're trying to help, or you're trying to work with is angry. And they stand up and they face you aggressively and they're yelling and they're blaming you and they're demanding things that are impossible or out of your control. And you start to feel angry, defense, stressed, unjustly attacked, hurt, harassed, and you want to yell back or defend yourself or storm out. That's not going to be helpful. What could you tell yourself? What could you do? And what could you say to the other person? So you just say, they're stressed. We're all stressed. It's a marathon. It's not a sprint. Let it go. Let it just roll off my back. They're hurting. They're scared. Right? I'm going to use my PFA skills. I'm going to send calm and caring. I'm going to say, you're angry. You're upset. What do you need? How can I help? It's really frustrating. It's really hard. You're really angry. You're really upset that it just didn't happen. Right? You see damaged buildings, dead bodies, injuries, people who are in pain or dying. You hear people moaning or crying, calling for help, and you smell medical smells, blood, smoke. You start to get teary, you start to hyperventilate, you want to run away. What can you do? What can you tell yourself? And deal with my feelings later. Right now, do what needs to be done. You train for this. Use the 4 for calm breathing. For the smells, put Vicks Vapor Rub on your upper lip to mask the smells. Focus on, what can I do just right now? You narrow your focus, and maybe you ask for help, or it's time to take 5. So there are 3 examples. Sorry, I said 6. I'm going to have to correct that slide. I want you to take your worksheet now. And I want you to write down at least one situation that would be difficult, right? This worksheet is your best friend. Use it for all kinds of situations. Make multiple copies. You can use it for situations that are personally difficult, interpersonally difficult, work-related, disaster-related, anything. Plan ahead. Make it very specific, very visceral. What will you see? What will you hear? What will you smell? What will you feel physically? What will you feel emotionally? What's going to be most upsetting? This is where you go into what the stuff you don't want to look at, but you do it ahead of time, kind of like an inoculation, so that you're prepared when you run into it in real life. It doesn't blindside you. If you get 6 or higher on a 0 to 10 distress scale, where 0 is completely calm and fine and 10 is really very upset, if you're starting to get, up to a 6, stop, take a break, go get some water, stretch, put it aside, come back to it later, use your skills. Write how you will respond well. What could you do? What could you say to yourself that's true and helpful, that's supportive and realistic? So write down your plan. And after you've got it written down, I want you to do 2 things. I want you to just read through it and walk through it in your mind, because that'll help pick up areas where you need more work, right? This is used by Navy SEALs. It's used by hostage negotiators. It's used by special forces. These are the skills that help in basically any stress, in dealing with any disaster. After you've written it down, after you've walked it through, I would love it if you would either type in the chat a little bit about the situation and your plan, or even better, just type your name in the chat and that you'd like to share. And Brian or Chris will unmute you so that we can have a little bit of the give and take and the learning with each other that we would in an in-person class. If you've written down a situation and you haven't been able to think of what to do, please also write in the chat if you're willing to share, and ask to be unmuted, and then we can put our heads together and brainstorm and come up with a solution. Which is actually how I learned about the Vicks Vapo Rub trick. I was teaching this course to a bunch of certs, and someone talked about the smells, and I was like, oh yeah, what would I do? And there was a fire chief there who stood up and shared this great tool. So take a minute, walk through this, and arm yourself in advance. The more prepared you are, the more confident, the more skillful, the more effective, the less stressed, the more resilient. Great. Okay, Brian or Chris, would you unmute Ken, please, so he can talk and we can share? I love learning. It's the best thing about these workshops.
Hello, can you hear me?
Yes, go ahead.
All right. I'm the emergency manager at California State University, Monterey Bay. My previous life was back in Ohio. I was a firefighter for 39 years, a volunteer. I was suffered from critical incident stress really throughout my career and didn't realize it. The topper that put me over the edge to have some really dangerous thoughts was I worked my own son at 5 years old and brought him back.
Ah,
And probably maybe 3 or 4 days later, coming back from a conference, I was looking for a place to drive off the road. Called my fire chief. We brought in our critical incident stress debriefing team, or defusing team as it's called now. Used to be, this was a long time ago.
right,
My son's
right.
30 now, so it's a long time ago. Went through that, went into counseling, and not recovered, but was able to deal with my traumatic stress. And I'm the one that actually wrote a book. It's called Hooked on Fire and Smoke. And it was all about my experiences through traumatic stress and, a responder's point of view of, the things that all the calls. I mean, I started when I was 14 years old in the fire service and was running rescue squad back in Ohio at 16. So,
Right. So if you were to maybe give an example of how you might have used the mentally prepare worksheet, how you might have mentally prepared.
it's something that can be incorporated now into first responders to have the training and this class and others like it to in advance. And I think the stigmatism that we put on traumatic stress, calling it a syndrome, calling it a disorder, is really, really bad, because people don't even want to go to the critical incident stress defusings. Uh, it's a stigmatism, and actually having these worksheets and things to go through this in advance and talk about what happens. And I think the best defusing we had a young firefighter. We were volunteers. A young firefighter, strong as an ox guy, 40 years old, had a heart attack and died. And the best defusing we got was from the funeral home came in, and they did an excellent job in working through it with our department. So
Well, and you know that they had practiced that and thought through, what am I going to say, what, right? Ken,
yeah.
Thank you so much. So yeah, no, mentally preparing makes all the difference. So we've got a few minutes left. I want you to step back and actually write down for yourself, what are 3 key skills or tools or phrases that you've learned so far? It could be 4 for calm breathing. It could be I help you. It could be see the need, say the need. It could be the stance you take with someone who's angry. It could be, yes, and, you know, and when, where, and how are you going to practice what you've been learning to prepare? So how will you use it in your work life? How will you use it in disasters? How will you use it maybe in your personal life? Because so many people have said to me, these are just good life skills, and I couldn't agree more. So write that down now. And we've kind of gone through the introduction, right? The stress skills. We've gone through the connection skills. Now we've gone through the difficult, challenging reaction skills. And next week is the dessert. Next week, we get to focus on skills that help prevent burnout. So put any questions or comments or anything you want to share in the chat. We've got about 5 more minutes. And I love what Melissa's saying. Yes, your tone, your approach, it's so much is in the tone. I can say, hi, I'm Elizabeth, I'm here to help, what's your name? Or I can say, hi, I'm Elizabeth, I'm here to help, what's your name? Same words, real different tone, real different impact. And we tend to get higher and more stressed and faster when we're stressed. So keeping our stress down helps us be more effective. Local friend, oh, in Monterey, you get together and practice mock drills. That is brilliant. That's brilliant, right? What's the Army say? Train how you want to fight, right? The more vivid your training can be, the more prepared you'll be in reality. Whether you do it physical training, whether you do even just mental training. But this mental preparation makes all the difference. Those breathing and grounding skills. Yeah. Yeah, absolutely. Build that muscle memory. Yeah. Yeah. Because what we practice is what we do. What we practice over and over is what we call overlearn. As a pianist, I definitely, you want that in your fingers. You don't want it just in your head. And particularly when I was dealing with difficult cases, I would find myself really thinking in the morning, well, what if I said it this way? Well, what if I said it that way? Well, what if this problem comes up? What are my options? How would that work? It's a beautiful way to just expand your skills. Okay, so you want to just raise your hand or put in the chat if you've done a mental prepare worksheet or if you've written 3 skills and thought about how you're going to practice. Because I want you to take from these classes what's going to work for you. Good. Sarah, yeah. Melissa, yeah. The more you do this, the more these skills will be there for you. Because, we hear stuff and we think, yeah, it's a good idea. And then we go on to the next thing, right? Sometimes 15 minutes later, you can't remember what you heard. But if you write it down, you remember it more. And if you write it down and you walk through it, hey, Jeremy, and you practice it, then it becomes right as if you have done it. You're literally creating neural connections in the brain, neural pathways. And you're creating the neural pathways deliberately and thoughtfully that you want to get activated under stress and disaster and traumatic situations. Not the old fight, fight, or freeze, built-in hardwired neural pathways. I want to thank you as always for taking the time, for giving me your attention, for being here and for sharing. Yes, right, yeah. Because when you run it through, you realize what's missing, or you realize what you might add, or you realize how you could make it better. And yeah, paying attention to that self-talk, right? That self-talk, those words, they program our brain, they direct our attention, they affect our body. So I hope you have a wonderful week. I'll see you back next Tuesday for a really fabulous. The tools this time for next week are from positive psychology research on happiness and creating a good quality of life. So have a good week and come back next week for the cherry on top, the dessert. Take care. I wish you all the best.